Hello, everyone. Welcome to Daily English Talk.
Hi, Jack. Great to be here again.
Today, we want to discuss something that affects many people. Sarah, do you have any fears?
Yes, actually, I'm really afraid of spiders. Even seeing a small spider makes me nervous. It's irrational, I know, but I can't control it. What about you?
I'm afraid of heights. When I'm up high, I feel dizzy and panicked. I can't even stand on a tall ladder. It's embarrassing sometimes. Do you think many people have fears like ours?
Absolutely. Most people have some kind of fear. Some fears are common, like spiders, heights, or flying. Others are more unusual. The important thing is that fears are normal. They're part of being human. Having a fear doesn't mean something is wrong with you.
What's the difference between a fear and a phobia?
Good question. Fear is a normal reaction to danger. Phobia is extreme, irrational fear that affects your daily life. For example, being nervous around spiders is normal. But if you can't go to certain places because you might see a spider, that's a phobia. Phobias cause real suffering.
How do phobias develop?
Many ways. Sometimes you have a bad experience. If you had a scary experience with flying, you might develop a fear of flying. Sometimes phobias run in families. If your parents were afraid, you might inherit that fear. Sometimes there's no clear reason. The fear just develops slowly.
Can you overcome a phobia?
Yes, you can. Many people have successfully overcome phobias with help. Therapy is really effective. Cognitive behavioral therapy is very popular. The therapist helps you face your fear gradually. You learn that the fear isn't actually dangerous.
How does therapy work exactly?
Different approaches exist. One approach is exposure therapy. You slowly expose yourself to the thing you fear. For example, if you fear spiders, you might first look at pictures of spiders, then watch videos, then see a real spider from far away. Gradually, your fear decreases. Your brain learns the spider isn't dangerous.
That sounds challenging.
It is challenging, but it works. Another approach is cognitive therapy. The therapist helps you change your thoughts about the fear. You learn that your anxious thoughts are often not true. You practice thinking differently. Both approaches help many people.
What about medication?
Some people use medication. Anti-anxiety medication can help, but doctors usually recommend therapy first. Medication alone doesn't cure phobias. Therapy combined with medication is often most effective. But everyone is different. What works for one person might not work for another.
How do you know if you need professional help?
If your fear seriously affects your life, you should get help. If you avoid situations because of fear, that's a sign. If your fear causes panic attacks, that's important. Panic attacks are scary. Your heart races. You can't breathe properly. You feel like something terrible is happening. If you have panic attacks, definitely see a doctor.
What are common phobias?
Very common ones are acrophobia, fear of heights, arachnophobia, fear of spiders, claustrophobia, fear of closed spaces, aviophobia, fear of flying, thanatophobia, fear of death, trypophobia, fear of holes. Some people are afraid of social situations. Some are afraid of public speaking. Some are afraid of needles or blood.
These all sound really difficult.
They are. Each phobia causes real suffering. But the good news is they're treatable. I've seen many people overcome their phobias. My sister was terrified of flying. She couldn't even book a plane ticket. After therapy, she flew across the country. Now she travels regularly. It was amazing to see her overcome that fear.
How did she do it?
She worked with a therapist for about 3 months. She did exposure therapy and breathing exercises. She learned that flying is actually very safe. She learned to manage her anxious thoughts. Now she feels confident flying. She still gets a little nervous, but it's normal nervous, not phobia nervous.
What breathing exercises help?
Deep breathing is very effective. You breathe in slowly through your nose for 4 counts. You hold for 4 counts. You breathe out slowly through your mouth for 4 counts. This calms your nervous system, your heart rate slows down, you feel less anxious. This simple technique really helps many people.
Can you use these techniques during the scary situation?
Yes, absolutely. When you feel panic coming, start breathing. Focus on your breathing. It gives you something to focus on besides the fear. It calms your body. Many people use this technique successfully. They practice breathing exercises regularly so they become automatic during scary moments.
What about other coping strategies?
Grounding techniques help. You focus on your 5 senses. What do you see? What do you hear? What do you feel? What do you smell? What do you taste? This brings you back to the present moment. It distracts from anxious thoughts. Talking to someone helps too. Share your feelings with a friend or family member.
Is it important to tell people about your phobia?
I think it helps. When people understand your fear, they can support you. They won't judge you. They'll be patient. Also, avoiding talking about it sometimes makes the fear bigger. When you acknowledge the fear and talk about it, it loses some power. Support from others is really important.
What about children with phobias?
Children can develop phobias too. Sometimes children copy their parents' fears. If a parent is afraid, the child learns to be afraid. So parents should be careful. Also, children shouldn't be forced to face their fears too quickly. That can make it worse. Gradual, gentle exposure with support works better.
What's the worst thing about having a phobia?
The worst is how it limits your life. You avoid situations. You miss opportunities. You feel embarrassed. You feel ashamed. These feelings are painful. Also, the constant worry is exhausting. You're always thinking about the feared situation. This stress affects your physical health too.
How does it affect physical health?
Constant stress and anxiety cause physical symptoms. You might have headaches, you might have stomach problems, your immune system weakens, you sleep poorly, you feel tired all the time. Long-term anxiety can cause serious health problems. So, treating phobias is important for overall health, not just mental health.
Is there any good news about phobias?
Yes, lots. Most phobias are treatable. Modern therapy is very effective. Many people have successfully overcome severe phobias. You don't have to suffer forever. Help is available. With proper treatment and support, you can overcome your fear. Life becomes so much better when you're free from phobia.
What advice would you give someone with a phobia?
First, know that you're not alone. Many people have phobias. Second, don't be ashamed. Having a phobia doesn't make you weak. Third, seek professional help. A therapist can really help. Fourth, be patient with yourself. Overcoming phobias takes time. Don't expect overnight change. Finally, use support from friends and family. You don't have to do this alone.
What have you learned from your spider phobia?
I've learned that fear is powerful but manageable. I have learned that facing fear takes courage. I have learned to be compassionate toward others with fears. I've learned that professional help really works. I'm still working on my phobia, but I'm making progress. I'm more confident now.
Thank you for sharing so openly about this, Sarah.
Thank you for asking. I think talking about phobias helps people. Many people suffer in silence. They think they're alone. But phobias are common and treatable. If someone is listening and has a phobia, please know you can get help. You can overcome this. Life is too precious to let fear control it.
That's wonderful advice. Goodbye, everyone.
Goodbye. And remember, facing your fears makes you stronger. You can do it.